I think what we have here at Boone County Hospital with our physicians and our staff is very special.
It's just a terrific place to practice.
Family doctors are doing a variety of procedures that may not be available in larger hospitals.
I think the future is bright. The practice that we have here at Boone County Hospital is ideal for a certain kind of family practice physician. We have a practice that allows a family physician to have a broad range of activities in the hospital.
I love that. I get to interact with all of the medical staff, and we have a very unique medical staff, mainly family physicians who practice full-scope family practice. They do everything from deliveries to procedures like colonoscopies or EGDs. Their practice is hospital-based as well, and so they take care of patients in the hospital, get a little bit of internal medicine that way as well. So it's just a terrific place to practice as a family physician. I was very excited to come work at a critical access hospital just from a longevity standpoint and a fiscal ability to survive these turbulent times with healthcare reform, and I felt more secure in this environment.
A physician coming to our community is not one of 2 or 3 or 4. It helps in a lot of different ways. There are specialties that are available to them for consultation. But it also gives them the kind of lifestyle that they're looking for. Our physicians are on call 1 night in 6 or 1 night in 7. Our emergency department is staffed by physicians 24 hours a day, 7 days a week. In some communities, a family practice physician might have to take their turn at staffing the emergency department. That doesn't happen in our hospital. So the lifestyle that we have to offer here, I think, is very good too.
This isn't small town, but it's certainly not big city. I've practiced in both of those environments, and I just really appreciate the pace and the people in a smaller town setting such as Boone. It seems like I have more time to really sit down and spend with the patients, and I think they appreciate that as well. And it's a wonderful opportunity to take care of patients from birth to grave.
We have a completely renovated hospital over the last 10 years. Brand new special care unit, obstetrics unit, all of our outpatient service areas, our surgery area, emergency department, radiology laboratory are all brand new. Our radiology department is completely digital at this point. We have a PACS system that's available to our physicians. Being
in a small hospital environment, many people think that we probably don't have access to some of the technology that the bigger hospitals do. And I'd say the opposite is true. I think we're actually ahead of the game in some aspects. The ER, we've been using an electronic medical record for over 2 years. Which I love. We also have CT we have 24-hour radiology service, 24-hour lab service. Another investment that we're making, like a lot of other hospitals at this time, is in our information technology systems. We're, over the next couple of years, investing millions of dollars in those systems. We have been able over the years to make the investments in our hospital to keep it state-of-the-art. I think folks that would come for a visit would find it to be very up-to-date, very modern. Are we profitable? Yes, we are. But the point is, are we taking that money and putting it to good use? And I think there's lots of evidence here that we are. One of the things that I'm very proud of, and one of the reasons I've been here as long as I have, is our relationship between our hospital and our medical staff is outstanding. We've got a group of physicians that are cooperative, that communicate with each other. We don't have the kind of interrelationship problems that some facilities have. One of the benefits to working in a smaller environment is getting to really know the people that you work with. The administrative team here is just so helpful, and they want to help make your job better and improve things upon the hospital. Those satisfaction scores happen as a result of having the kind of people here that the physicians are going to like to work with. You don't achieve those scores without a nursing staff that not only knows nursing, but also knows how to take care of a patient as somebody who's more than likely a neighbor or a friend or the friend of a friend. So that's the kind of atmosphere that you get here, and you get it across the board. We have full service departments staffed with people that are exceptional. We've got folks that know their job, that do their job, but do it in such a way that they make people feel special. My wife and I came here when our children were
We're quite young. I think our oldest was in second grade when we arrived in Boone, and we quickly found that this was the kind of place that we wanted to raise our family. Schools are excellent, but the other thing that we really enjoyed, that we really thought was valuable, is our community is of a size that you know where your children are. You know who their friends are, you know their parents, you know the activities they're involved in.
I've been happy with raising my family here. I have 3 children, and they've gone through the community schools. They've had opportunities to do a lot of things that in larger school districts they may not have been able to do. They participated in sports and choir and orchestra and academic team and a variety of other things.
If you want to be involved in a community and be involved in what your children do, this is the place to do it.
One of the other great opportunities about Boone is just the surrounding environment. Boone is a perfect setting as far as the school systems, the parks. Ledges is absolutely gorgeous.
Boone's located on the Des Moines River Valley. It is one of the most beautiful parts of the state. There are a number of campgrounds. The area is beautiful. We've got some state parks. The Ledges State Park is absolutely wonderful.
But we're also just 15 minutes away from Ames and Iowa State University, so you have all of those perks with the sporting events and the fine arts and different opportunities that way. And you're only 35 to 45 minutes from the Des Moines metro area, 45 minutes to Jordan Creek Mall and to several restaurants and theaters and things like that. So it's just a terrific way to have everything just right there at your doorstep.
I'm a golfer. I will tell you that we've got 3 beautiful golf courses within 15 miles of Boone that I take advantage of as much as I possibly can. So what we feel like we have here is just an ideal situation. We've got a practice for a physician that wants to take care of their patients from the time they're in the clinic to those times they're in the hospital. We've got a situation where the call schedule is not a burden. We've got other peers and specialist physicians that are available that can support those physicians. And we've got a town that is a small town with all the big city things that you want to do within just half an hour, 45 minutes. So we think it's a great opportunity. I think what we have here at Boone County Hospital, I think what we have in our community, I think what we have with our physicians and our staff is very special. I'm proud of it. I'm glad to have been a part of it, along with hundreds of other people. And I think the future is bright. There are some uncertainties in healthcare, but I think the kind of mix of people that we have here, our hospital, our community, I'm very excited about the future. This is the kind of place that a physician is going to move into the community, get a practice started, and I think be thrilled at the end of a career that this is the decision they made.